Dementia of Alzheimer's by Maddie Sotos and Mallory Spencer. In 1901, there was a 51-year-old woman that was sent to an asylum in Frankfurt. She had language and cognitive defects, delusions, and hallucinations. Alois Alzheimer was a doctor at the hospital where she was sent. The woman died and her brain was sent to Alois for him to examine. He presented his case at a meeting and he called it Alzheimer's disease. In the 18th century, the word dementia had a clinical and a legal usage referring to states of psychological incompetence regardless of age, and later it was viewed as an irreversible disorder.
Dementia of Alzheimer's. This type of dementia is the most common form. It is a neurological disease, meaning related to the nervous system, that is characterized by a loss of mental ability that can serve enough to interfere with normal activities.
Some symptoms of Alzheimer's include difficulty performing familiar tasks like tying your shoe, memory loss like forgetting your name or the date, problems using language, disorientation, loss of good judgment, problems with abstract thinking, misplacing things, rapid mood swings, personality changes, and loss of initiative and loss of interest.
Known causes. Scientists aren't sure exactly what caused it, but toxic reactions to alcohol and drugs, nutritional deficiencies, infections that affect the brain, or an illness to the brain, or head injury.
In order for us to diagnose his disorder, we had to use the DSM. And our diagnostic criteria is said that the patient had to either have memory impairment or one or more of these disturbances. These disturbances include aphasia, which is language disturbance, apraxia, impaired ability to carry out motor activities, agnosia, failure to recognize or identify objects, or disturbance in executive functioning, which is planning and organizing. We found that our patient had disturbance in executive functioning because he could not plan things once he needed to. The DSM continued. Our diagnostic criteria said that the cognitive deficits in Part A each cause significant impairment in social or occupational functioning. Our patient started separating himself from his family and his friends. Part C said that the course is a gradual onset and continuing cognitive decline. Over the past 9 years, it has been getting more and more serious. Part D of our diagnostic criteria explained that the cognitive deficits in Part A cannot be due to any of the following. These include other central nervous system conditions that cause deficits, like Parkinson's disease and Huntington's disease, or systematic conditions that are known to cause dementia, like vitamin deficiencies, hypothyroidism, or etc., or substance-induced conditions. The last parts of our diagnostic criteria included that the deficits do not occur exclusively during the course of a delirium, and the disturbance is not better accounted for by another axis disorder, like major depressive disorder or schizophrenia. Our patient's name is Ed, and he is 68 years old, and he has been evaluated for the past 9 years. He started having memory problems, and they have been increasing with time. Ed's mood also started to change from an outgoing and happy person to someone who avoided conversation. Ed has no family history of any cognitive or psychiatric disorders, and he has always been in good general health. Overview of the case study. The patient was 68 years old. He was evaluated for 9 years. He had gradual loss of memory, frequent mood changes, no history of cognitive or psychiatric disorders, and he was always in good general health. Ed's own characteristics that he had during the course of his disorder. Changes in mood. He stayed away from others in interaction. He paced during the night. He turned the heater one night to 500 degrees. He was threatening to his wife, and he had trouble staying focused.
After Ed was evaluated for the first time, his symptoms started to get better, but eventually his wife started noticing that different things were happening. Ed started to pace most of the night, lock himself in the bedroom, and become physically threatening to his wife. His wife had no other choice but to put him in a care center 120 miles away from her home. People more susceptible to get this disorder. Women are 2 times more likely to get it than men. Age 65 and older have a greater chance of getting it. Obesity, high blood pressure, and diabetes. Articles, studies, and books done on dementia of Alzheimer's. Genetic linkage study, Duke University. Allie from The Notebook, Into the Abyss, Away from Her, The Savages. These are other books relating to dementia of Alzheimer's. Famous people that had dementia of Alzheimer's are Ronald Reagan, Sugar Ray Robinson, and Norman Rockwell.
There is no cure for dementia of Alzheimer's yet, but there are medications you can take to help slow down the process. Acetylcholinesterase inhibitors work by helping to increase the amount of acetylcholine in the brain. It's a chemical that is important for memory and learning. The following are all medications to help Alzheimer's. These include Aricept, which is approved to treat all stages of Alzheimer's disease, Exelon, which is approved to treat mild to moderate Alzheimer's disease, Exelon patch, which is approved to treat mild to moderate Alzheimer's disease, and Razadine, which is approved to treat mild to moderate Alzheimer's disease.
Prognosis for people with Alzheimer's disease. Average life expectancy is 8 to 10 years, highly dependent on person's age plus other medical problems. Patients generally die of medical complications such as the flu or pneumonia. Alzheimer's is a fatal disease.